Well, good morning, everybody.
Good morning.
And again, thank you to the organizers. It's really my pleasure to be here and just, you know, to add my voice to those who came before me. Thank you for having us and having us again, year 7. And to borrow some of the Congressman's word, I feel like today is a day of fierce determination. I liked that theme, fierce determination and commitment. And so when the picture comes to DC, what I want to do is just highlight 5 issues today that I don't think are new issues to anyone, but they are issues that I believe we've got to direct our fierce commitment, our fierce determination and commitment to, and that commit to taking baby steps even when we haven't gotten all the way to solutions, because we just can't stay where we're at. So my 5 themes are health disparities and hopefully beyond health disparities, borrowing some of Jeff's highlights about masking some of the issues sometimes. Stigma and what that's doing at a local level for health and HIV literacy and action and advocacy. Drilling down within our Latino communities about communities at risk within communities. Few elements of immigration and how that affects us locally. And then finally on the 5th issue, when some of our safety nets, like the ADAP program, the AIDS Drug Assistance Program, can't keep up with demand, when our supply can't keep up with demand in these hard times, who are the most vulnerable people who are going to really lose out? So, number 1, health disparities. I think a lot of people here probably know from the headlines here in DC, situation from HIV is very dramatic and very unfortunate. Overall, over 3% of our population, our adult and adolescent population, are already diagnosed in living with HIV, and that doesn't count everybody who hasn't been tested and don't know that they're positive yet. So the absolute numbers are definitely higher. So how does that relate to our Latino population? Well, we heard the national figures about health disparities, and I think sometimes that's the only thing we look at when we look at the numbers. And actually, if we look at Washington, D.C., 8% of our population are Latino, but only 4% of our HIV/AIDS cases are Latino. So you'd say, wow, we're doing great, right? No health disparities, nothing to do. And of course I'm joking on that because I think we all immediately start to say, well, what are the things we don't measure? What about all those people who aren't getting services, aren't getting tested, and aren't getting diagnosed? Surely the number of Latinos who are actually infected is higher than that, 4% of all the cases that we're measuring. And I think there's some truth to that. Even though we have some great community-based organizations who really reach out and do tremendous work with our Latino population. But you know what? There are also plenty of things that we do measure that sometimes we don't take a look at that help us to see what those really dramatic needs that we might be missing are. And in this last year's HIV report for GC, one of the things we did is we just actually broke down the number of people who've been diagnosed by race and gender according to population. And what we found is 3% of our Latino men in DC right now have already been diagnosed and are living with HIV or AIDS. 3%. Now, most places in the world, CDC and WHO consider 1% a huge, dramatic population level epidemic. So 3% of all of our Latino men in the city are already diagnosed and living with HIV. So that health disparity would mask the actual absolute numbers we're looking at. This is dramatic. So it's important that we not only think about what we're missing in our measurements, but actually use the measurements we have and say, how do we program to scale? How do we address and find the people who need these services? So issue number 2, stigma. Preaching to the choir, I'm sure here. But just most recently, I hope some of you have seen our most recent Ask for the Test campaign. It's a campaign that's actually out there to try to drive direct-to-consumer marketing for providers offering HIV tests in the healthcare environment. And what it is a campaign that has local people, local faces, local stories, and everybody saying that, hey, when I go to the doctor, I ask for the test. And everybody has their theme about why they're asking for it, not just for themselves, but for things they care about. I ask for the test because I care about my congregation. I ask for the test because I care about my family. Well, we recruited for those campaigns by putting out ads and saying, hey, you want to be in a commercial? Come on, because we want real people and real stories. And we have a bunch of different faces and stories. We've got young black gay men, we've got an older African-American pastor, we've got, young couples, we've got all sorts of couples. The face
faces that were the most difficult to recruit for was actually the Latino family. And we had a lot of people who answered the ads, and once they found out it was an HIV campaign, says, oh, no, I don't want to be associated with an HIV campaign. And ultimately, it was one of our advocates and civil servants and a member of the mayor's office who heads up the Latino affairs who said, I'll be the face of HIV, and my family will be part of this, and my team will do it. I'm doing it for the family and the community. But I think how much more difficult it was to even recruit for a face is a symptom of how far we have to go. And while we are committed as DC government to making more information like these campaigns, but also services available and accessible and available to our Latino population, one thing that we miss out on with that overriding level of stigma is we miss out on learning from each other. People can learn a lot from government or from healthcare providers, but they need to learn from each other as well. And so I think, baby steps, call to action. We as a government can commit to doing everything we can, but we also need leaders at every level. We need family members at every level. We need, non-health providers at every level to put HIV onto the conversation table and say this is something as Latinos we can deal with and we need to get smart about and talk about.